Welcome to another episode from the Veterinary Medicine Digest. Today, we delve into the sophisticated world of veterinary diagnostics, specifically focusing on the manifold and increasingly vital applications of angiography in canine medicine. Angiography, often performed using computed tomography or magnetic resonance techniques, has evolved far beyond a simple visualization tool, becoming indispensable for planning complex surgeries, guiding minimally invasive interventions, and achieving definitive diagnoses in challenging cardiac, neurological, oncological, and visceral cases. We will explore how these advanced imaging modalities are shaping the future of care for our canine companions, revealing intricate vascular architectures previously invisible to the clinical eye. One striking contemporary application of angiography in dog centers on diagnosing severe cardiac injury following trauma. Blunt chest trauma, often resulting from incidents like being hit by a car, can lead to a variety of cardiac lesions, such as damage to the free walls, coronary arteries, cardiac valves, papillary muscles, pericardial and myocardial contusions, and injury to the interventricular septum. While morphological changes in the heart are less commonly recognized than post-traumatic arrhythmias in veterinary medicine, myocardial damage should always be considered in patients who have experienced significant blunt chest trauma. For instance, one case described a 6-year-old Airedale Terrier involved in a car accident that subsequently developed a persistent arrhythmia and a markedly elevated serum cardiac troponin I level, indicating significant myocardial damage. In this specific and challenging case, initial transthoracic echocardiography revealed a large, cavernous lesion within the interventricular septum, exhibiting fluid accumulation and a mass effect that bowed into the left ventricular cavity. Crucially, computed tomography angiography confirmed the diagnosis, identifying a fluid-attenuating cavitary lesion occupying most of the interventricular septum that did not enhance after the intravenous injection of iodinated contrast medium. This comprehensive visualization led to the diagnosis of a ventricular septal splitting and intramural hematoma formation, a rare post-traumatic condition in dogs that mirrors findings in human medicine. The clarity offered by the computed tomography angiography proved essential in documenting this rare post-traumatic septal hematoma, which was characterized by a hemorrhagic dissection within the septum and splitting of myocardial bundles with accumulated blood. This highlights the necessity of multimodal imaging for accurate diagnosis and monitoring of traumatic cardiac lesions, demonstrating how computed tomography angiography provides a vital cross-sectional view to complement echocardiography. Moving beyond acute trauma, angiography plays an irreplaceable role in diagnosing congenital heart diseases that involve complex vascular anomalies. Among the most challenging congenital heart defects is the sinus venosus atrial septal defect, which is frequently associated with partial anomalous pulmonary venous connection in both dogs and humans. An atrial septal defect itself is relatively rare in dogs, and the sinus venosus type appears particularly uncommon, making up less than 1% of canine atrial septal defects reported in one study. The anatomical nature of the sinus venosus atrial septal defect, located at the roof of the interatrial septum near the entry point of the right pulmonary veins, physically predisposes it to coexisting with partial anomalous pulmonary venous connection. This combination can cause significant right heart volume overload, potentially leading to pulmonary hypertension. While transthoracic echocardiography is the common diagnostic method for atrial septal defects, this technique alone proved insufficient for a definitive diagnosis in several cases, having missed the defect entirely in 3 out of 10 cases reviewed in one study, and failing to detect the co-occurring partial anomalous pulmonary venous connection in any instance. The inability of transthoracic echocardiography to reliably detect partial anomalous pulmonary venous connection stems from the fact that these abnormal vessels are located outside the heart, presenting a significant diagnostic challenge. Computed tomography angiography, however, proved to be an invaluable diagnostic tool, achieving a definitive diagnosis in all surveyed cases by clearly identifying the defect in the interatrial septum and confirming the presence of partial anomalous pulmonary venous connection in every dog. The ability of computed tomography angiography to provide high diagnostic accuracy in humans with sinus venosus atrial septal defect and partial anomalous pulmonary venous connection translates effectively to the canine setting. In the dogs studied, computed tomography angiography further characterized the anatomy, showing that the anomalous pulmonary veins drained into various locations, including the right atrium, the junction of the cranial vena cava and right atrium, or the cranial vena cava itself. In one case, the right cranial pulmonary vein drained into the cranial vena cava, which, to the author's knowledge, represented the first such report in dogs and resembled the most common supracardiac type seen in humans. This level of detailed anatomical mapping provided by angiography is essential for guiding subsequent surgical repair, which typically involves cardiopulmonary bypass and constructing an intraatrial baffle to redirect the anomalous flow. The diagnostic value of angiography, therefore, lies not just in diagnosing the defects, but in planning the specific surgical strategies required for complex corrections. The detailed imaging provided by computed tomography angiography is also pivotal in assessing atrial septal defects for device occlusion procedures, which represent a less invasive alternative to open-heart surgery. For successful device occlusion to be feasible, the defect must be smaller than the available occluding devices and, critically, possess an adequate rim of atrial septal tissue, typically 75% or more of the circumference, to ensure stable device placement without interfering with adjacent structures like valves or pulmonary veins. Accurately assessing this rim tissue is profoundly challenging without multidimensional imaging. In a case series evaluating dog for device occlusion candidacy, computed tomography angiography with retrospective electrocardiogram gating was performed under conscious sedation to thoroughly evaluate the atrial septal defect anatomy and surrounding structures. To maximize procedural planning, the data acquired from the computed tomography angiography scans were used to generate three-dimensional reconstructed models. These models were viewed using specialized software and three-dimensional glasses in a mixed reality environment, allowing the interactive manipulation of the stereoscopic heart model. This advanced visualization proved invaluable for pre-procedural planning, particularly for determining the presence of adequate tissue rim. The results highlighted the value of this approach. In 4 out of 5 dogs, the angiography-derived models demonstrated inadequate or absent rim tissue in a dorsal or cranial dorsal location, often in close proximity to the right pulmonary vein ostium, thereby making device occlusion unsuitable. In the one dog deemed suitable based on the model's findings, a hybrid device occlusion procedure was successfully performed, emphasizing how computed tomography angiography and its derived models serve as a crucial gatekeeper for determining procedural candidacy. The utilization of extended reality three-dimensional images generated from computed tomography angiography datasets is an invaluable addition to patient-specific anatomical assessment and procedural planning for congenital and structural heart disease, offering benefits like anatomical evaluation, training, and communication. Angiography also aids in diagnosing and managing other complex cardiovascular anomalies. For example, a rare acquired defect known as a ruptured right sinus of Valsalva aneurysm into the right atrium was diagnosed in a 10-year-old Shih Tzu presenting with a continuous heart murmur. Initial transthoracic echocardiography suggested a cardiac shunt from the aorta to the right atrium due to an aneurysmal dilation arising from the right sinus of Valsalva, with a defect opening into the right atrium. To confirm this, electrocardiogram-gated computed tomography angiography was performed. The angiography showed contrast agent influx into the right atrium, clearly delineating the right sinus of Valsalva aneurysm and the connection between the aneurysm and the right atrium, while also confirming that the coronary arteries were normal. This specific type of rupture, classified as a type 3A right sinus of Valsalva aneurysm, is typically associated with rupture into the right atrium. Angiography helps differentiate this condition from other shunts, like ventricular septal defects, by revealing the characteristic continuous shunt flow that persists throughout the cardiac cycle, reflecting the constant pressure gradient between the aorta and the right atrium. In addition to acquired cardiac conditions, angiography is integral to interventional cardiology procedures, such as the treatment of severe subaortic stenosis. Subaortic stenosis is a common congenital heart disease in large breeds, and severe cases often lead to clinical signs like exercise intolerance, weakness, and syncope. In a 6-month-old Rottweiler with severe aortic stenosis, a transarterial approach was used to perform a combined cutting balloon and high-pressure balloon dilation, an interventional procedure aimed at reducing the pressure gradient across the stenosis. While the source does not detail the angiographic images utilized during the actual intervention, the procedure itself relies on cardiac catheterization and fluoroscopic guidance, which incorporates real-time angiography to navigate catheters and deploy the balloon devices safely across the aortic outflow tract. This use of angiography is foundational to the field of interventional cardiology, enabling the precise placement and monitoring of therapeutic devices within the cardiovascular system. The critical diagnostic power of angiography extends to oncology, where it is used extensively for pre-procedural planning of minimally invasive therapies like transarterial chemoembolization and prostatic artery embolization. For prostatic artery embolization aimed at treating prostate cancer, computed tomography angiography is crucial for mapping the anatomical variations of the prostatic artery and identifying all tumor-feeding vessels. Prostate cancer in dogs has a poor prognosis, and prostatic artery embolization offers a selective therapeutic technique that targets tumor-feeding vessels to reduce blood flow, minimizing damage to surrounding organs like the urethra and bladder. In one retrospective study, the origins of 102 prostatic arteries were evaluated using computed tomography angiography. The most frequent origin was identified as the internal pudendal artery, designated as type 1, accounting for 98% of cases. Although this high consistency suggests anatomical variations may not significantly affect the duration of the procedure in most cases, the sources stress that confirming these variations pre-procedurally is vital for a smooth intervention. The small diameter of the prostatic artery, approximately 0.98 millimeters on average in control dogs, presents a major challenge. Making accurate pre-procedural diameter measurement via computed tomography angiography essential for selecting appropriate catheters and microcatheters. Furthermore, computed tomography angiography successfully identified the complex tumor vasculature in dogs with prostate cancer, revealing that while the prostatic artery was the major supplier in all cases, the caudal vesical artery and or umbilical artery also acted as cancer-feeding arteries in a significant proportion of dogs, often corresponding with bladder invasion. These findings emphasize that all three major vessels, the prostatic, caudal vesicle, and umbilical arteries, must be considered target vessels during prostatic artery embolization. The precise anatomical data gathered through computed tomography angiography was then utilized to develop an innovative tool, a three-dimensional printed prostate cancer model. This model, based on a case with the most common arterial variation, allowed interventionalists to practice transarterial selection and embolization simulation under fluoroscopic guidance. This simulation confirmed the feasibility of the embolization procedure, offering a training environment that enhances proficiency and potentially reduces procedural duration, radiation exposure, and the risk of complications such as non-target embolization leading to bladder necrosis in actual patients. A similar application of angiography supports the transarterial chemoembolization of oronasal tumors. Oronasal tumors are common and often aggressive in dogs, carrying a poor prognosis if left untreated, and radiation therapy, while effective, carries potential side effects. Transarterial chemoembolization offers an alternative minimally invasive therapy by selectively blocking the blood supply to the tumor. This procedure is technically challenging due to the complex vascular anatomy of the head arteries and the associated risk of cerebral infarction from non-target embolization. Triple-phase computed tomography angiography is considered essential for defining the tumor's vascular involvement and identifying specific feeding arteries. A study analyzing 61 canine oronasal tumors identified 100 feeding arteries. The distribution of these feeders varied significantly based on the tumor's anatomical location. For example, the descending palatine artery was the most prevalent feeder for nasal tumors, followed by the infraorbital artery. Rostromaxillary tumors primarily derived their blood supply from the infraorbital artery. In contrast, mandibular tumors, both rostral and caudal, predominantly received blood from the facial artery. Tumors located on the tongue were often supplied by both the facial and lingual arteries. This precise mapping, provided by angiography, allows interventionists to target vessels like the descending palatine artery, infraorbital artery, and facial artery for super-selective catheterization during the procedure. Computed tomography angiography also allowed for the measurement of vessel diameters, confirming that these major feeding arteries were suitable for the use of small microcatheters required for super-selective intervention. Furthermore, unlike in humans, the computed tomography angiography analysis of canine head arteries revealed a consistent pattern where the lingual and facial arteries originated separately, rather than from a common trunk, crucial anatomical information for minimizing the risk of complications during transarterial chemoembolization. Angiography is also essential in the diagnosis of cerebrovascular pathology presenting with neurological signs. Internal carotid artery dissection is a condition frequently associated with Horner syndrome in human patients, but which had not been described as a cause in dogs. A case report detailed a 5-year-old golden retriever with acute onset isolated Horner syndrome, characterized by meiosis, ptosis, and third eyelid protrusion. Routine magnetic resonance imaging and computed tomography were unremarkable, but advanced angiography sequences revealed key abnormalities. Magnetic resonance angiography, specifically three-dimensional time-of-flight magnetic resonance angiography, showed progressive luminal narrowing of the left internal carotid artery, followed by a filiform, string-like appearance. Concurrently, magnetic resonance imaging with fat saturation techniques indicated a loss of the normal vessel flow void along with hyperintensity in the lumen, findings that closely resemble the presence of an intramural hematoma or thrombosed false channel, characteristic of dissection in humans. Computed tomography angiography further supported this by highlighting marked narrowing and irregularity of the left internal carotid artery. The combination of these angiography findings with the isolated neurological deficit led to a presumptive diagnosis of left internal carotid artery dissection. The case suggests that internal carotid artery dissection should be included in the differential diagnosis for Horner syndrome in dogs and argues for the routine addition of magnetic resonance angiography sequences to the magnetic resonance imaging protocol for dogs with isolated Horner syndrome. A related field where angiography informs diagnosis is in understanding conditions that cause cerebral small vessel disease. In a 6-month-old Rottweiler with severe subaortic stenosis, the dog developed severe neurological signs post-intervention that progressed rapidly to coma, prompting euthanasia. Necropsy revealed chronic cerebrocortical necrosis in the brain, with multiple hemorrhages, vessel congestion, and gliosis, consistent with chronic ischemic damage seen in cerebral small vessel disease in humans. Although the balloon dilation was performed via transarterial access, the anatomopathological findings suggested that the underlying issue might be chronic cerebral hypoperfusion caused by the severe obstruction of blood outflow from the left ventricle, which led to structural changes in the small blood vessels, similar to findings in humans with severe acquired aortic stenosis. While angiography was not used to diagnose the brain pathology directly, the interventional procedure itself relies on angiography, and the underlying cardiac condition diagnosed via continuous wave Doppler echocardiography as severe subaortic stenosis, a lesion that restricts arterial flow, demonstrates the deep connection between cardiovascular defects assessed by angiography and downstream vascular consequences. Angiography is also the gold standard for assessing congenital portosystemic shunts, specifically to determine the functional status of the portal vasculature before surgical attenuation. In dogs with extrahepatic portosystemic shunts, the diversion of blood away from the liver causes the intrahepatic portal branches to appear reduced in diameter, number, or level of branching, a condition known as secondary portal vein hypoplasia. The critical diagnostic challenge that angiography addresses is the differentiation of secondary portal vein hypoplasia from portal vein atresia, a rare condition where the portal branches are vestigial or poorly developed, precluding flow to the liver. Surgical attenuation of the shunt is typically not recommended in cases of true portal vein atresia due to the high risk of severe portal hypertension if the blood flow cannot be accommodated by the liver's portal system. Computed tomography angiography is widely recognized for assessing the morphology of the extrahepatic portosystemic shunt. However, it has a crucial limitation. It cannot dynamically assess the hepatic portal vasculature under pressure. This limitation makes computed tomography angiography unreliable for assessing the functional capacity of portal branches or accurately differentiating between secondary portal vein hypoplasia and true portal vein atresia when portal branches are absent or poorly visualized. In a study evaluating dogs with extrahepatic portosystemic shunts, where computed tomography angiography showed absent portal vein branches, surgical exploration was pursued based on clinical indicators. The study highlighted the necessity of dynamic evaluation, specifically intraoperative mesenteric portovenography, performed during temporary shunt occlusion, which pressurizes the portal system. In 2 dogs where the portal vasculature was invisible on computed tomography angiography, the intraoperative mesenteric portovenography revealed intrahepatic portal vasculature only after temporary shunt occlusion, providing the critical information needed to safely proceed with shunt attenuation. This confirms that computed tomography angiography alone has limitations in complex cases and validates the continued importance of dynamic angiographic techniques like intraoperative mesenteric portovenography in guiding treatment strategies for portosystemic shunts. Beyond conventional angiography, specialized techniques are advancing diagnostic capabilities in specific areas. For imaging of the aqueous humor outflow pathways in the eye, aqueous angiography is utilized in research settings. This dynamic imaging technique provides real-time information on the distal, post-trabecular structures of the conventional outflow pathway in canine eyes. A study investigated the effect of acutely increasing intraocular pressure, mimicking glaucoma conditions, on these outflow pathways in normal canine eyes using a combination of aqueous angiography and other imaging. The researchers used aqueous angiography with tracers like fluorescein or indocyanine green infused into the anterior chamber to visualize the outflow. They found that acute elevation of intraocular pressure significantly reduced the heights of the scleral lumens, which are distal aqueous outflow vessels, often causing larger vessels to collapse more dramatically than smaller ones. The utility of aqueous angiography here lies in establishing a causal relationship between elevated pressure and structural changes in the outflow vessels, providing crucial insights for developing new diagnostic and treatment tools for canine glaucoma. Finally, the sources highlight the comparison between different angiography modalities and the identification of incidental findings during procedures. A study comparing time-resolved imaging of contrast kinetics magnetic resonance angiography with computed tomography angiography for assessing vascular characteristics in head and neck tumors demonstrated that both techniques are valuable but have complementary strengths. Computed tomography angiography generally offers superior visualization and clearer delineation, particularly for arterial structures, and has a significantly shorter acquisition time. This superiority is partly attributed to its ability to capture images at the peak contrast enhancement phase due to rapid scanning. However, time-resolved imaging of contrast kinetics magnetic resonance angiography excelled in differentiating vessels from surrounding bone, effectively reducing bone-related artifacts that can interfere with vascular delineation in computed tomography angiography. This advantage is particularly important in the cranial region, where intracranial veins are often enclosed within or adjacent to bony canals, making their visualization challenging with computed tomography angiography due to artifacts. Furthermore, time-resolved imaging of contrast kinetics magnetic resonance angiography provided comparable or superior performance in visualizing venous structures and effectively identified tumor-related feeding and draining vessels, showing similar diagnostic performance to computed tomography angiography in this domain. As time-resolved imaging of contrast kinetics magnetic resonance angiography captures dynamic vascular changes continuously, it reduces dependency on precise contrast injection timing and offers a more consistent depiction of both arterial and venous phases over time. These findings suggest that time-resolved imaging of contrast kinetics magnetic resonance angiography serves as a strong complementary imaging modality, especially for surgical and radiation therapy planning in neuro-oncology cases. In a final note on procedures involving computed tomography angiography, one study addressed the occasional detection of pneumorachis, gas within the vertebral canal, in dogs undergoing computed tomography angiography for non-traumatic causes. This finding was identified in 19% of the dogs reviewed, a significantly higher prevalence than previously documented. The presence of pneumorachis and associated intraforaminal gas was hypothesized to be primarily intravascular and iatrogenic, originating from inadvertent gas administration through an intravenous catheter, possibly during anesthetic induction or contrast injection. The study noted that the presence of gas was overwhelmingly right-sided in the dogs scanned in sternal recumbency, a finding hypothesized to be secondary to the ipsilateral location of the azygous vein, where gas travels from the peripheral catheter up the cranial vena cava and migrates against gravity into the azygous vein and then dorsally into the internal vertebral venous plexus. Crucially, the presence of this gas was documented to be an incidental, non-clinically significant, and likely transient finding, as no dogs developed neurological deficits or immediate post-computed tomography complications. This understanding, derived from angiographic imaging, provides assurance to clinicians when incidental gas is detected during computed tomography procedures. In summary, the current uses of angiography in canine medicine are vast and rapidly expanding. They range from vital pre-procedural mapping for minimally invasive tumor therapies and complex shunt repairs to critical differential diagnostics for neurological and traumatic cardiac conditions, and even extend into advanced research for conditions like glaucoma. Angiography, particularly in its forms utilizing computed tomography and magnetic resonance, is continually pushing the boundaries of what is surgically and therapeutically feasible for dogs, while also generating crucial safety data about the procedures themselves. Thank you for listening. The titles for the referenced papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging,